A lot of women, whether you've had a baby or not, know that bladder leakage is a real thing, especially if you are a runner. I'm Dr. Christina, the Picky PT, and I'm here to explain to you today how that does not have to be a problem for you because pelvic floor physical therapy is here to help. If you like to know about this kind of information, how you can avoid injury, pain, or bladder leakage, then make sure to like and subscribe to this channel so you can continue to be up on the latest information that I share with you for free. Urinary leakage often comes down to pressure mismanagement in your abdomen. So as I've explained in past videos, your pelvic floor muscles are not just the muscles that are underneath you, your sling muscles. They also include any muscle that touches your pelvis at all. That includes your abdomen, your back muscles, rib cage, and even all the way up to your shoulder blade. So when you're running or walking and you have the form of being really arched in your back, which is what we call is lordosis, and so you're putting a lot of your pressure forward, what I want you to imagine is that you're putting a lot of pressure forward onto your bladder because your bladder sits a little bit more towards the front of your trunk. So if instead, as you're walking or running, you do a better job of pulling that core in and shifting your bladder and your organs back into the center of your abdomen, you're going to be less likely to have urinary leakage. So what that would look like is when you're running, instead of running with your chest super upright and your back arched, you want to be engaging your core from your lower abdominals and your upper abdominals and running with a slight lean forward, like 20 degrees. This is going to take the pressure off your bladder and make it less likely that you suffer from urinary leakage. Another issue that you want to watch out for is your form from side to side. If as you walk or you run, you tend to land with your hips popping out to the side, that's also going to change the pressure that happens onto your bladder and possibly cause leakage. So instead, working on keeping your hip underneath you as you walk or run, so landing like this versus with your hip popped out, is going to keep all of your organs towards the center of your trunk and take the pressure off of them versus having all of that pressure force through it each time that you land and then you're unable to control holding your bladder. It's a great way to practice walking first before you get to running because you can control this a lot easier when you're going slow and controlled versus running can be a little bit uncontrolled at first. So I tell people that I really like when you're doing interval running where you mix walking and running because you can use the walking portion to really dial in on your form, making sure that your core is engaged like it should be, making sure your hip is engaged like it should be. And that way, when you do run, you're carrying over those habits into your running form as well. And it's going to decrease urinary urgency and also your urinary leakage. If you try these things out and it doesn't make a difference, then make sure to see a neuromuscular expert, a pelvic floor therapist who can design a really personal plan for you and make sure that you're doing things exactly right to take the pressure off of your bladder and improve the pressure management within your abdomen. I promise you there is hope. Running and having urinary leakage is not normal and it can be helped. You just need to reach out to the right people.